I've been experiencing this pain for a very long time. This is like the first time that I felt that everything would be okay. And I didn't feel like that. I thought I was going on the verge of surgery and, I was just going, the other direction. And now I actually feel like everything's gonna be okay and I'm gonna have my life back.
How is the glute and the back of the thigh doing since last treatment?
It's doing a lot better. Can I show you my face?
Delicious. Show the camera.
So that's sore, so I'm dealing with that.
Figured, right?
But I always judge my experience or how my session has with how quick I'm able to get up in the morning and how I'm able to drive. And that's a lot better. I've been experiencing this pain for a very long time, and this is like the first time that I've felt like a glimpse of, what is the word? Like just that everything would be okay. And I didn't feel like that. I thought I was going on the verge of surgery and, I was just going, the other direction. And now I actually feel like everything's gonna be okay and I'm gonna have my life back. Huge change from feeling like this for 6 months. And then like last month, I've just been progressively getting better.
In the exam, Kim was at 22 inches?
Yeah.
And standing lumbar pelvic flexion, SLPF. And now she's going ahead, touch your toes. Let me know when you're done.
I'm done.
Okay. Put your hands together for me. We're at 18 inches. What do you feel here?
A lot of pulling on
Where?
the back of my thigh.
Right posterior thigh pulling, 0 to 10.
6.
Perfect. 6. You're so good at the numbers. So last time she left you, she was at 14, 15. Started at 19, 14, 15. Now she regressed back. So that means that we had the strengthening problem we got to get back in. We got to get into. But I don't think she's ready yet. But today would be a good day. We could test it out. Come on all fours for us, please, with your feet hanging off. As you can see, the ruler is completely flat on her back. She's 0 to 6 inches flat. What do you feel here?
Pulling on the back of my thigh and
This one.
and on my glute a little bit. Like we're actually
CCX. 0 to 10 pulling.
like a 4.
4. Cool. That means that her spine is supposed to curve and it's not. So it tells me that there is limited tissue that's causing her not to flex. So it's either coming from the back directly, but I like to believe that's more coming from the belly. So today we're gonna have more fun with experimenting with Kim because I haven't done much left side treatment. So today you're gonna watch me just treat the left side first. We're gonna retest those tests and then we'll see how that changes. 62. What do you feel here?
Pulling on the back of my thigh.
Proximal posterior thigh, pulling 0 to 10.
8.
8?
9.
Increase? No, let me do it. You relax. Increase?
Yeah.
Increase the dorsiflexion in the same spot?
Yeah.
Okay. I'm grabbing her psoas. All this is contracted. This is all contracted. If anything I palpate or feel that it goes to the butt on the right side, let me know.
Okay.
So
It's already pulling, so okay, I'll tell you.
she's sidelining. Oh
Right
yeah,
there.
this is juicy. Chewing to the butt?
Well, no, it just hurts there.
Oh yeah, this is great. So anyone who knows and can feel adhesion, you guys will have a blast on Kim because you just find so much on her. I am feeling for the femoral nerve, and right here, this is probably the worst spot. Now the question is there access for me to treat it? And I'm finding better access more distal than proximal, and right in here in that nook. I'm gonna gain my depth. You hear her breathing heavy. You know she's uncomfortable. As I'm trying to palpate, her body contracts. This is already contracted, just her at rest, and this starts to contract more when I want to palpate and treat. She's not comfortable. I want to make it more comfortable for her and put her through less pain. If I can make tension reduce just by the shockwave.
Should get more now.
5, 4, 3, 2, 1. Good. Now, just look at that. Look at that. Look how soft that is. Look how much nicer that is. Is the pressure less intense laying down right now? You can say no.
No.
Okay. And the access is actually more in here. So I'm next to the nerve on the psoas. I'm gonna separate them too. Go ahead. There's tension. She's fighting me. That's okay. There it is. And 3, 2, 1. Good, Cage. L3 femoral nerve psoas. Moderate to severe, and all this is better. She has stuff from the nerve roots needed to the psoas, but we're not getting there today. We're just gonna get the outside of it. Now we're gonna focus a little bit lower. I'll give her a timeout though. Well, we're treating the psoas. All this muscle connects directly to the vertebrae in the low back spine. So when this muscle is contracted, it's getting pulled. When it's getting pulled, since it connects to the low back is getting pulled with it. Whether we sit, whenever your hip comes over 90 degrees, that's when the psoas becomes in usage, right? It's when we're starting to use it. So we sit in chairs all of our lives in school. We sit in desks at work. We like to work out and do all these things. We're just constantly adding load on this guy over here that starts to pull on the low back. Now one day, you bend over to brush your teeth. I can't get back up. Now we're in this situation. So right now, I'm just trying to palpate, and it seems like her psoas and her iliac is actually stuck together. Right in that junction. I'm getting my depth. Curling my finger a little bit. Go ahead, Cage. Good. Way faster right there. First of all, that movement was way faster.
Yeah, it was.
Hi-oh, look at that.
It's 16. She's reaching for her set. Oh! 15 inches. What do you feel here?
I feel pulling on my back side, but like more lower than right here.
Good. 0 to 10.
Like 34.
Kim, did you have any kind of like inciting injury, or is this just stress on the back over time?
I would like to say that I was cool enough for it to be like some immediate injury, but it was just
accident.
yeah. It's just
She was a fighter. She used to fight.
well, I just like dancing. I was very active. I'll say that I was just very active. And I just gradually, I guess, over time, wrong forms. Nobody teaches you how to brush your teeth properly or walk or stand or sit properly. So just being in the wrong simple movements every day.
Good. Sorry. Go ahead. I'm just separating them. Good. When I'm treating patients and figuring out what diagnosis is more of a priority, we always think joint or disc, right? But I also think about what are the patient's symptoms or where they're coming from. Because then now I have to differentiate whether it's local or is it joint. So this is a good playing around game. That's why I haven't treated the left side. We treat the left side, glutes better, so we know that's joint related.
What does local mean?
If pain's here, look, adhesion and spot is right here. If pain's here, we treat it, nothing's better, but we treat this and that gets better, joint. Is the ache still gone? Or the ache is still came back? Interesting, right?
Yeah.
So we did a lot of right side low back treatment, so it makes me lean more to the left side, needs more treatment than the right. So focus on the left side next visit. So we're gonna do this a couple of times. We wanna make sure which area pulls the tightness, right? So you're gonna slouch like this and you come back. But I'll tell you when.
Okay.
You shockwave?
Yes. I haven't shockwave her, and I feel like what my fingers are?
Yeah.
Or just sitting?
Side. Or just sitting, I think.
Okay. Slouch? No. Come back. Slouch. Come back. Slouch. Come back. Slouch. Come back. That feels tighter on the way back. Slouch. Come back. Slouch. Come back. So you can relax sitting up, however is more comfortable. We're gonna do this flexion motion, and KG is gonna help encourage her in the front so she can flex more of the spine. I'm gonna shockwave your disc, okay? Are you okay? And keep slouching, slouch more. Can she flex her thoracic? It's easy to do the same thing over and over again and be like, oh, they're getting better, right? But the best thing about it is just being curious and how we can try different things that help the body, because if we do the same thing over and over again, eventually something else is going to need to want to show up, right? Hope that makes sense. Same?
Less.
The glute?
This.
See, that's what's more interesting, because I would thought that was local. Right? Sciatic nerve. Just chalk with the disc, just the back of the thigh is less. For the next couple of days, your disc, your spine might feel a little sensitive or a little loose. Just be easy. Don't go too crazy. Just take it easy for the next 2 or 3 days. And let us know how you're doing with that. Come on all fours for us. Let's remeasure that. Crunch up. A little better. I'm seeing 0 to 475. Come over here, Greg. What do you feel here? 0 to 10 pulling posterior thigh. 2. Good, coming up.